Thank you, Mr. Chairman. I want to thank all the people who put this assessment together. I want to thank the VA for cooperating and working so hard to help get the assessment done also. And Mr. Chairman, thank you for your work in bringing us to this point. Secretary McDonald, I have a really specific question. I want to ask you a local question and then broaden to a general and a national question. But first of all, I see in your written statement that you referenced a potential lack of funding for 4 major construction projects and 6 cemetery projects. Since the cemetery project in my district is already well under design, is it still on track for construction funding in 2017? And will a funding shortfall in any way impact the Southern Colorado cemetery construction?
Thank you for the question, Congressman Lamborn. Those 6 would be new cemeteries. The project in Colorado would be okay.
Okay. All right. Then let me broaden to a larger, more general question, but very vital. I believe that access to care and streamlining community care are critical, and we've talked a lot about that this morning already. Are you on track to deliver the new Veterans Choice Program by November 1st, 2015, as promised?
I would say we're making progress. In fact, the authorizations climb by multiples every month. But I would say, just like we talked about variability in the VA system, there will be variability. I was with Dave McIntyre last night of Tri-West, for example. It's going to take us a while to build capability in some of the geographies where, not surprisingly, there's a shortage of primary care physicians or mental health physicians. But we are working it as hard as we possibly can, and I'm hopeful, and I believe that the consolidation of all the programs will make choice even more effective. Why? Because we'll go to one program that our employees have to administer, and the veterans will only have one program for outside care. So I think it will simplify things dramatically.
Okay, thank you. And Dr. Girard, I hope I pronounced that correctly. One of the things that you referenced of the many that need reform or improvement is physician productivity. What are your specific recommendations in that very critical area? I mean, we could talk about so many things, and I know we will during the rest of this hearing, but that's one I'd like to drill down on.
Thank you for that question. If you take the top line that, for example, VHA primary care physicians have 14% fewer patients, or that the specialists are much below the 50th percentile in productivity, the immediate potential response might be, well, get the physicians to work harder. But it's a much more complicated problem. As I outlined, there needs to be improved clinic space. That improved clinic space implies, though, that the VA has the authorities to make leases in less than 6 to 9 years to do that. It means that hiring a nurse doesn't take 6 months or 8 months or 9 months. It takes 2 months, like it does in the private sector, because you lose those people. It also requires scheduling. Imagine if your calendar was on 6 different separate screens, depending on whether the person was a constituent, a non-constituent, a member. Well, that's sort of the scheduling system that we found in many of the VAs, which makes it impossible to understand what the physician's real schedule is going to be. So I think on the near term, these are the kinds of issues that can promote productivity even within the system and enhance the job satisfaction among not only the physicians and the staff, but again, as Mr. Burns said, think of all those cornerstones: leadership, governance, operations, and data and tools, and I think this is one example of them, and hopefully that answered your question to some degree, sir.
Well, it really helps, and that's something I'll work with you. I know that all of us here have Dr. Rowe, and everyone here has a concern about that specific area, Dr. From Ohio, and we all want to work with you on this. I mean, this is so critical. So I'll work with Brad, and thank you, and I yield back the balance of my time.
Thank you.